Alzheimer's disease, a progressive neurological disorder impacting over 55 million people globally, stands as the leading cause of disability and dependency among individuals aged 45 and older, yet it is frequently misconstrued as an inevitable facet of aging, despite its insidious onset beginning decades before overt symptoms manifest, making the identification of 6 early warning signs for slowing disease progression and bolstering long-term brain health. The first sign, changes in posture, gait, or coordination, often dismissed as mere age-related decline, can signal underlying neurological alterations. For instance, individuals may take shorter, shuffling steps, drag their feet instead of lifting them, or struggle with fine motor tasks like using utensils, buttoning shirts, or writing legibly, reflecting the brain's diminishing control over motor functions due to deteriorating cognitive pathways. These subtle shifts, which might initially appear inconsequential, can lead to frequent stumbles, difficulty navigating familiar spaces like one's home, or even falls that increase injury risk, particularly in older adults with weakened bones. Research suggests that these motor impairments stem from the brain's prefrontal cortex and basal ganglia, areas critical for coordinating movement, which are early in neurodegenerative diseases like Alzheimer's and Lewy body dementia. Caregivers might notice an individual leaning to one side, adopting a slumped posture, or hesitating before stepping over thresholds, all of which warrant medical evaluation to differentiate dementia-related changes from other conditions like Parkinson's disease or peripheral neuropathy. The second sign, sensory impairments, extends beyond memory loss to disrupt how the brain processes sensory input, affecting depth perception, spatial awareness, and even the sense of smell, with studies showing that an inability to identify common odors, like coffee or flowers, can precede Alzheimer's diagnosis by years. Individuals may misjudge distances, spill liquids when pouring, or struggle to climb stairs, increasing the likelihood of accidents, while disorientation can make crowded environments, like busy stores, overwhelming, causing them to bump into furniture or feel lost. Heightened sensitivity to noise, such as wincing at loud sounds or struggling to discern voices in a noisy restaurant, or progressive hearing loss, which affects 3 adults over 65, further compounds cognitive strain as the brain expends extra effort to process auditory information, accelerating memory decline. Research from Johns Hopkins University indicates that untreated hearing loss in midlife raises dementia risk by up to 50%, underscoring the need for hearing aids or auditory as preventive measures. The third sign, reduced grip strength, often overlooked, serves as a tangible indicator of early neural changes, with studies in The Lancet linking weaker hand grip in older adults to a 20 to 30% higher dementia risk over a decade. Difficulty opening jars, carrying groceries, or holding objects firmly may reflect not only muscle loss but also declining neural communication between the brain and muscles, a process exacerbated by reduced physical activity, which further hastens cognitive deterioration. Strength training, such as light weightlifting or resistance band exercises, can counteract this decline by enhancing muscle mass and stimulating brain-derived neurotrophic factor, BDNF, a protein that supports neuron growth. The fourth sign, sleep disturbances, is both a symptom and potential contributor to dementia, encompassing insomnia, excessive daytime sleepiness, fragmented sleep, or REM sleep behavior disorder, where individuals physically active, often distressing dreams, kicking, punching, or shouting, due to disrupted brain regulation, a hallmark of Lewy body dementia. Chronic sleep deprivation, affecting 40% of older adults, inflames the brain and impairs the glymphatic system's ability to clear neurotoxic proteins like beta amyloid, which accumulate in Alzheimer's. For example, someone who never napped may suddenly require frequent daytime naps, or they may wake multiple times nightly, feeling unrefreshed, which over time erodes memory consolidation and emotional resilience. Sleep issues through cognitive behavioral therapy for insomnia, CBTI, sleep hygiene practices like avoiding screens before bed, or treating sleep apnea with continuous positive airway pressure, CPAP devices, can mitigate these risks. The fifth sign, apathy and social withdrawal, distinct from situational depression, manifests as a pervasive loss of interest in once enjoyed activities such as gardening, reading, or attending family gatherings, coupled with reduced emotional expressiveness, appearing indifferent to joyful or sorrowful events. This emotional blunting, driven by dementia's impact on the brain's limbic system, can lead to social isolation, which itself doubles dementia risk, per a 2020 Nature study, as social engagement stimulates cognitive networks. Unlike depression, which often ties to external stressors, dementia-related apathy persists regardless of circumstances, puzzling loved ones who may misinterpret it as laziness or disinterest. The sixth sign, language difficulties or aphasia, is among the most recognizable early indicators, with individuals struggling to recall simple words, e.g., saying shirt instead of jacket, pausing frequently mid-sentence, or repeating phrases unknowingly, reflecting disruptions in the brain's temporal and frontal lobes. These challenges, which may begin subtly, a colleague's name or hesitating during storytelling, can evolve into significant communication barriers, causing frustration and social retreat. Early detection of these signs is paramount. Seeking medical evaluation promptly can rule out reversible causes, vitamin B12 deficiency, thyroid dysfunction, or chronic stress, enabling interventions such as cognitive training programs, which challenge memory and problem solving, or speech therapy to bolster communication skills. Lifestyle adjustments, including 30 to 40 minutes of daily aerobic exercise like brisk walking to enhance cerebral blood flow, a Mediterranean or MIND diet rich in omega-3 fatty acids, berries and leafy greens to combat oxidative stress, and 7 to 9 hours of restorative sleep to facilitate toxin clearance, can significantly slow cognitive decline. Building cognitive reserve through lifelong learning, playing musical instruments, solving crosswords, or learning a new language, strengthens neural pathways while managing chronic conditions like diabetes, hypertension, or high cholesterol, reduces vascular damage that exacerbates dementia.
Beyond these early signs, 10 classic dementia symptoms underscore its profound impact on memory, cognition, and daily life, necessitating early intervention to manage progression and enhance quality of life. Memory loss, the hallmark symptom, extends beyond occasional forgetfulness to disrupt daily activities, with individuals forgetting recent conversations, missing appointments, or repeating stories unaware, while misplacing essentials like wallets or medications. Without retracing steps becomes routine. In later stages, even cherished long-term memories like a wedding day or a child's name may fade, leaving individuals unable to recognize loved ones. Difficulty following conversations driven by the brain's reduced capacity to process and retain information results in losing one's train of thought mid-sentence, substituting vague terms like thing for specific objects or repeating phrases, particularly in noisy settings, leading to embarrassment and social withdrawal that isolates individuals further. Mood and personality shifts transform once vibrant individuals into irritable, suspicious, or apathetic versions of themselves with paranoia, believing others are stealing or conspiring, straining relationships as dementia disrupts the brain's emotional regulation centers. Family members often notice these changes first, grappling with the emotional toll of seeing a loved one's essence altered. Poor decision-making manifests in risky behaviors, such as falling for financial scams, impulsive purchases, or neglecting personal safety, like leaving the stove on while simple tasks, cooking, budgeting, or dressing appropriately, become daunting, reflecting impaired executive function. Time and place disorientation causes confusion in familiar settings, with individuals losing track of dates, seasons, or locations, mistaking the present for decades past, increasing wandering risks that affect 6 in 10 dementia patients, per the Alzheimer's Association. Repetitive questioning, like asking about a family member's arrival repeatedly, stems from the brain's inability to retain new information, frustrating caregivers who can use visual aids like calendars to ease tension. Misplacing items in illogical places, phones and refrigerators, keys in sugar jars, coupled with inability to retrace steps, often leads to accusations of theft in advanced stages, reflecting memory circuits. Hallucinations, prevalent in Lewy body dementia or severe Alzheimer's, involve perceiving non-existent sights, sounds, or smells, such as hearing voices or smelling smoke, which can trigger fear or aggression, necessitating medical evaluation to exclude medication side effects or infections. Incontinence, a late-stage symptom, results from the brain's loss of control over bladder and bowel functions, causing individuals to miss restroom cues or forget bathroom locations, leading to shame, social retreat, and caregiving challenges that often prompt assisted living. Early detection of these symptoms enables medical assessments to slow progression through medications like cholinesterase inhibitors, lifestyle change, brain exercises, and caregiving plans to ensure safety and support, preserving cognitive function and quality of life as long as possible. Preventing dementia hinges on lifestyle strategies that reduce risk and preserve cognitive vitality into old age, as research underscores that up to 40% of dementia cases may be treatable through modifiable factors, per a 2020 Lancet Commission report. Building cognitive reserve through lifelong learning, mastering a musical instrument, tackling Sudoku, learning a new language, or engaging in strategic games like chess or bridge, fosters robust neural networks that delay symptom onset, with studies showing bilingual individuals develop dementia 4 to 5 years later than monolingual peers. Regular physical activity, such as 150 minutes weekly of moderate aerobic exercise, walking, cycling, or strength training, boosts cerebral blood flow, reduces inflammation, and enhances neuroplasticity, with a 2019 neurology study finding that active individuals have a 28% lower dementia risk. A brain-healthy diet, like the Mediterranean or Mind diet, emphasizes nutrient-dense foods, salmon, walnuts, spinach, blueberries, that combat oxidative stress and neurodegeneration, while the ketogenic diet, high in healthy fats and low in carbs, may improve cognitive performance by supplying ketones as an alternative brain fuel. Avoiding processed foods, sugary drinks, and trans fats further protects against inflammation. Managing chronic conditions, including diabetes, hypertension, obesity, and sleep apnea, is critical, as high blood sugar damages brain vessels, high blood pressure causes vascular dementia, excess visceral fat fuels inflammation, and untreated sleep apnea deprives the brain of oxygen, all increasing dementia risk. Controlling these through diet, exercise, weight management, and medical treatment like CPAP for sleep apnea preserves cognitive health. Prioritizing 7 to 9 hours of uninterrupted sleep nightly allows the glymphatic system to clear beta amyloid and tau proteins, with consistent sleep schedules, limited caffeine and alcohol, treatment for insomnia or sleep apnea, enhancing memory consolidation and brain repair. Avoiding smoking and excessive alcohol, which accelerate neurodegeneration by reducing brain oxygen or damaging cells, is essential, with quitting smoking cutting dementia risk by 30% within years, per a 2018 Journal of Alzheimer's Disease study, and moderating alcohol to 1 daily for women or 2 for men, protecting cognitive function. These strategies, mental stimulation, exercise, nutrition, health management, sleep, and avoiding harmful substances, empower individuals to significantly reduce dementia risk, proving that small, consistent changes yield profound long-term benefits, and dementia is not an inevitable fate of aging. Recent advancements in dementia research offer hope for those at risk, with monoclonal antibodies like lecanemab and donanemab marking a breakthrough by targeting and removing beta amyloid plaques, a hallmark of Alzheimer's, slowing cognitive decline by 27 to 35% in early-stage patients, per 2023 trials published in the New England Journal of Medicine. These drugs, administered via infusion, represent a shift toward disease-modifying therapies, improving quality of life for patients, and easing caregiver burden, though they require careful monitoring for side effects like brain swelling or bleeding. Ongoing research explores combination therapies targeting multiple neurodegenerative pathways, such as tau protein accumulation and inflammation, alongside gene therapies addressing genetic risk factors like the APOE4 gene, which increases Alzheimer's likelihood threefold. Non-invasive brain stimulation techniques like transcranial magnetic stimulation, TMS, show promise in enhancing memory and cognition by modulating neural activity, with early trials suggesting benefits from mild cognitive impairment. Despite these advances, early detection remains the cornerstone of effective management, as interventions are most impactful before significant brain damage occurs. Recognizing early symptoms, whether motor, sensory, sleep, emotional, or linguistic, prompts timely medical evaluations, lifestyle changes, and access to emerging treatments. Adopting brain-healthy habits, including cognitive exercises, regular physical activity, a nutrient-rich diet, quality sleep, and chronic disease management, not only reduces dementia risk but also enhances overall well-being, offering individuals and families hope for a future where cognitive vitality. As research progresses, the prospect of more effective therapies grows, but proactive prevention today remains the most powerful tool to safeguard brain health for years to come, urging everyone to invest in their cognitive future now.